Fee-for-service may stay to some degree. It's not possible to think about creating, say, bundled payments for everything. If you think about advanced medical diagnosis or advanced treatment, for complex problems, it may not be possible to say we can do this with the same set of resources every time, and that's really what's necessary to create a bundle. You have to have some understanding of what are the necessary resources and are they fairly consistent with every application. So for a small part of medical practice, I believe fee-for-service will be appropriate and be appropriate that way for a long time. However, for the really common things, certainly you can use bundled payments, you can use prospective payments, you can use global payments. There are lots of options. I think what is fundamentally different, though, is to say the expectation for us is actually to produce health. Now, the definition of health is what is critically important in that circumstance. In the pay-for-value movement in the United States, the idea seems to be that we will pay for the value of performance measured in clinical terms. So, for example, a person with diabetes, the provider would be held responsible for achieving glycemic control, a level of fasting blood sugar less than 130, or a hemoglobin A1C of less than 7, or blood pressure control of systolic blood pressure less than 130. But at the Center for Innovation, our research shows that people, that is patients, are really not thinking about that when they think about health. A few years ago in Austin, Minnesota, a small town where we were doing some observational research with our designers, we sought to understand what people really meant by health. And the best definition of health that I have heard recently came from a woman who was diabetic, but said, health to me means that I can do everything that I need to so that the people who depend on me will be okay. To her, it meant that she could be a mother, a spouse, and a good employee since she worked. She wasn't thinking about the measurement of her blood sugar, or she wasn't thinking about the measurement of her blood pressure. It was about how we could make her feel able to do the things that she needed to do. The U.S. delivery system is sorely missing measures of health. And to the extent that we continue to spend hundreds of billions of dollars every year trying to produce these measures that for most people are irrelevant, not only are we wasting all of those resources, but we're really making the delivery system focus on things that are not as important. So that's one of the points that you'll hear from us, especially in Transform. We need to think differently about how it is that we create health and how it is that we approach the healthcare that will achieve that goal.